presiding over today's event and for his constant support and leadership at TGAMC. I request Dr. Yunus sir to escort sir onto the dais. Thank you, sir. We are deeply honored to have with us today a resource person, Dr. R.S. Shreedhar sir, Surveillance Medical Officer, WHO Ballari. Sir, we are truly grateful for your presence and for sharing your expertise with us. I request Dr. Yunus sir to escort sir onto the dais. I would request Dr. Mahmood Yunus sir to welcome the guests officially. I request Dr. Yunus sir to escort our RMO, Dr. Tamim sir, to the dais. I would like to request Dr. Mahmood Yunus sir to welcome the guests officially.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Respected dignitaries on the dais and off the dais, it gives me an immense pleasure to welcome you all to this orientation program on vaccine preventable disease surveillance. This program is a small step towards strengthening our knowledge and role in public health, especially in the timely detection, prevention, and awareness of vaccine preventable diseases. The Government of India launched the Universal Immunization Program in 1985 with prime aim of providing free vaccine to all eligible children and pregnant women against the life-threatening diseases. Today, the Universal Immunization Program covers 12 major vaccine preventable diseases and is one of the largest immunization program in the world. And it is estimated that globally, 3.5 to 5 million deaths are prevented every year through the immunization. Today, we are very lucky to have an eminent speaker with us, Dr. R.S. Shreedhar, Surveillance Medical Officer working at WHO Ballari. He has a great experience in tracking vaccine preventable diseases and planning public health programs. I'm sure this session will be more informative and inspiring for everyone. Now, I would like to request Dr. Madhav Dikari sir to present a flower as a token of respect to the sir.
ಪಿಜಿಸ್ ಬಂದಿಲ್ಲ ಎಲ್ಲ ನಿಮ್ ಪಿಜಿಗಳೆಲ್ಲ ನೋಡಿ ಎಲ್ಲ ಕರೆಗೆ ಬಂದಿಲ್ಲ ಇದು ಬಹಳ ಕಮ್ಮಿ ಇದಾರೆ. ಪಂಚಕರ್ಮ ಪಿಜಿ ಎಷ್ಟಿದ್ದಾರೆ?
Thank you, sir. Now I would like to request Dr. Kendamat sir to present the flower as a token of respect to our beloved and respected principal sir. Thank you, sir. Now I request. Now I will welcome our beloved in-charge RMO sir, Dr. Tamim Ansari sir.
I would request Dr. Yunus sir.
For you.
Thank you, one and all.
ದೀಪಾಚರಣ ಆಮೇಲೆ ಆಯ್ತಾ ಮೊಬೈಲ್ ಎಲ್ಲ ಸ್ವಿಚ್ ಆಫ್ ಮಾಡ್ಕೊಳ್ಳಿ ಅಥವಾ ಸೈಲೆಂಟ್ ಇಟ್ಕೊಳ್ಳಿ. ಆಯ್ತಾ ಎಲ್ಲ ಮೊಬೈಲ್ ಎಲ್ಲ ಸೈಲೆಂಟ್ ಇಟ್ಕೊಳ್ಳಿ. ಅದು
Please keep the mobile silent mode.
Like, give condolence for the life lost at yesterday's Pahalgam attack.
Please.
Calculate the time. You.
Let's start by seeking the blessings of the Almighty. I invite Jyoti and Bhagya to lead us in the prayer. Namami Dhanvantari Avirekam Suraivandita Padapatma Loke Jusham Bhavna Isham Dhanvantari Sarva Ayurveda Pravata Isha, Isha, to, sig- to signify the dawn of new knowledge and enlightenment, let's now proceed to the lamp lighting ceremony, a symbol of wisdom and brightness. I request respected Principal Sir, our resource person, and RMO Sir to kindly join us for the lamp lighting ceremony.
Direct ಇಂದ ಬರ್ತಾ ಇದೆ. ಬನ್ನಿ ನಂಬೋಜಿ, ನೀವು ಬನ್ನಿ ಸ್ಟೂಡೆಂಟ್ಸ್ ಮಾಡಿ. ಮಾಡಿ.
Thank you, dignitaries. Vaccines have saved millions of lives, but their true power is unlocked only when they are backed by strong surveillance system. Surveillance helps in identifying outbreaks early, monitoring vaccine coverage, and ensuring that no one is left behind in the immunization journey. Today's session is a stepping stone for us all, as interns, PG scholars, and students to gain real world insights into how surveillance works and what role we play in strengthening public health system. To formally inaugurate today's orientation, I now invite our respected Principal Dr. Sir to address the gathering.
Respected Dr. Shreedhar, who is working in the WHO sector in Ballari, RMO of the institution, today's RMO, Dr. Tamim Ansari, all my esteemed colleagues, esteemed faculty of this institution, here UG and PG students, and house surgeons of this hospital. The Ayurveda also, swasthasya, swasthya rakshanam. That is the first motto of Ayurveda. Swasthasya, swasthya rakshanam. So prevention is better than cure. This is the actually motto of Ayurveda. In many times we see Ayurveda is promoted for treating the diseases. But actually 75% of Ayurveda is meant for preventing the diseases. 25% is only managing the diseases, and many occasions they have mentioned that these diseases are asadhya, anupakramya, asadhya. So, prevention is better than cure. In Ayurveda, whether vaccination was there, they have mentioned the immunity, what gives the immunity. They have mentioned the concept of pujas or immunity. Then one more concept is there in the Charaka Nidana Sthana, Rameha Nidana, Vikara Vigata Kara Bhava Bhava Prativishesha. There is a disease opposing factor is there in the body. Whatever the Nidana Sevana, the etiological factors are there, but still disease can be prevented because there is a disease opposing factor is there in everybody's body. The same thing is done by the vaccination. We are opposing the disease by creating the immunization. So the immunization has two aspects. One is opposing the disease factor and defeating the disease. रोगोत्पादक प्रतिबंधकत्वम रोग बल विरोधित्वम. There are two aspects Ayurveda has. Roga bala virodhitvam, rogotpadaka pratibandhaka. So in that aspect, now already established immunization is there for 12 preventable diseases. So in our hospital also, number of patients are visiting. I am very happy that our Honorable District Commissioner has mentioned in a meeting that Sarnath College is a very good college, sir, very good hospital that has number of patients are visiting. It's a referral hospital. Actually in Kalyana Karnataka region, ours is the only government hospital which is imparting free treatment. Free treatment, all levels of people we give free treatment, and number of patients are visiting our hospital. In last year we had 79,700 patients have visited in 2024. Our hospital statistics says like this. So among these patients, many patients come without immunization in the 12 preventable diseases. So our doctors, our junior doctors, our postgraduate, they should identify this. And if any such diseases comes also, they should alert the system. There is a WHO system in every country that all this immunization should be proper and these preventable diseases should be prevented. In that aspect, one is we can identify the such diseases and we can report to them. Second thing is we can identify the persons, those who are visiting the hospital, if they have not exposed to that 12 types of immunization where the preventable diseases are there, we can refer them. So in this aspect, I found that this kind of lecture will be definitely useful to the patients, those who are visiting our hospital. Hence, all the doctors, those who are prefixing DR in their name, they should know about this. In that, that's why I have called all of you for this presentation. And I thank Dr. Shreedhar, who has himself, he approached me and told that I should give one lecture in your institution so that awareness program should be created. So I thank all of you for attending this in a large number. All of you are attending this program. Thank you. Thank you, Anas.
For your motivating words. Now, it's my privilege to welcome our distinguished resource person, Dr. R.S. Shreedhar, SMO, WHO Ballari. Sir has vast experience in disease control, immunization program, and surveillance strategies across various regions. Let us now listen and learn as he takes us through the practical and policy aspects of vaccine preventable disease surveillance.
ಸ್ವಲ್ಪ ಲೇಟ್ ಆಯ್ತು. ನಾವು one minute ನಾವು ಇದು ಮಾಡಿದ್ವಿ, ಮಾರ್ನಿಂಗ್ ಮಾಡಿ ಸ್ಟಾರ್ಟಿಂಗ್ ಅಲ್ಲಿ ಮಾಡ್ಬಿಟ್ಟು ಸರಿ. ಸೆಕ್ರೆಟರಿ ಆಯ್ತು ಸರ್, ಒಳಾಯ್ತು. ಓಪನ್ ಮಾಡಿದ್ರು
Respected Principal Sir, Dr. Shreedhar, RMO, and Dr. Yunus, who is behind this orientation program, and all the faculty and students. A very good afternoon to all of you. I'd like to reiterate that this is a routine orientation program started in the college for supporting the vaccine preventable diseases surveillance. In a way, it again helps to boost the universal immunization program in the district as well as in the state and country. So this is a routine program because the PGs and faculty, PGs will be changing every year. So it's a practice that almost every 6 months, the PGs everywhere. So be it WIMS or any other medical college or Taranath College, they will be oriented regarding BPD surveillance. And mind you that Taranath Government Ayurvedic Medical College is also a reporting unit for reporting all these cases of vaccine preventable diseases. And there is one more thing here, adverse events following immunization. It's a combined reporting system. On every Monday, the hospital is reporting to the district RCH officer. So I thought just updating you regarding what is exactly has changed in 2024 for adverse events following immunization surveillance also. So hence it is a combined orientation on vaccine preventable disease surveillance. What is that you are supposed to do? And adverse events following immunization, what you are supposed to notify. And before starting this, as told already, it is to support the universal immunization program. And my job has been made a little bit easy by the inaugural speeches themselves, that the universal immunization program is there in the background. So to facilitate its implementation and quality, these VPD surveillance as well as AEFI surveillance programs are now integrated into it. So let us get into VPD, Universal Immunization Program. 1 or 2 minutes about this. Already, I think it's been told that the Universal Immunization Program or UIP has been christened since 1985. But there are some things prior to that also. In 1948, I think BCG was among the first vaccines introduced in India in a limited area. Maybe TB was a menace by then. So BCG was the first vaccine to be started. And 1962, this BCG vaccination became a part of this National Tuberculosis Control Program. And 1978, not only BCG, some more antigens are also added. That is diphtheria, pertussis, tetanus, and oral polio vaccine. And typhoid was there in 1978. And that program was called Expanded Program of Immunization. So BCG was there and it was expanded onto other 5 antigens. That is why it was called EPI in 1978. And 1985 saw the name as Universal Immunization Program. So there was a small change. Measles was added, typhoid was removed. So Viparyasa anta ಹೇಳಿದ್ರೆ now typhoid is waiting to come back into the universal immunization program. So okay, surveillance is going on. So there is a sentinel surveillance for typhoid disease in select metros. After getting the data, maybe typhoid vaccine also will be getting into the program. So how mammoth, how large is this program? You can see by some of these statistics. This universal immunization program of the country caters to almost 3 crore pregnant women annually, and about 2.6 crore children annually will be covered by this universal immunization program. And as rightly told, 11 antigens are there in the universal immunization program nationally. Subnationally, in districts like Ballari, Kolar, Chitradurga, Davangere, which are endemic for JE, we have JE vaccination also. So that is why it is 12 vaccine preventable diseases as far as Ballari is concerned. And to preserve these vaccines in proper cold chain, we have almost about 30,000 cold chain points across the length and breadth of the country. And to administer these vaccines can be, if it can be given, so it is feasible. I think Tarnath Government Ayurvedic Medical College Hospital also can start because the people will come from UPHC, they will sit here almost for the half day, so and administer vaccines to the needy children. So this is about the universal immunization program in the country, and you can see these things. All vaccines which are administered under UIP are manufactured in India. That's the very precious thing we have now, and we have the largest manufacturing capacity in the world. So COVID pandemic has proven it, and then COVID vaccines, how we got administered to almost all the adults also. Adult vaccination, it was a very big lesson in adult vaccination. And that time, everybody lauded this manufacturing capacity of the country. And not only the program has passed several milestones. I've highlighted very few of them. So one is through immunization, we could eliminate or eradicate diseases. So first blood was smallpox. So smallpox was eradicated in 1977 through vaccination. And gone are the days of glass syringes and reusable needles. So auto-disable syringes were introduced since 2005. Now, one child, one prick, it is AD syringe, one AD syringe, auto-disable syringes. And to check the potency of the vaccines due to heat damage, we have vaccine vial monitors on all the UAP vaccines since 2006. And very sweet news to cherish, that is in 2014, after a long gap, after 1977, we didn't had any success. So in 2014, India officially got certified as polio-free, and followed by 2015, maternal and neonatal tetanus elimination were the significant milestones that we have crossed in this universal immunization program. And since 2015 onward, the program really started sprinting. So that is the success story of universal immunization program in the country. And this is the schedule, the latest updated schedule that is being followed in universal immunization program, aptly called 5 साल 7 बार ಅಥವಾ 5 ವರ್ಷದಲ್ಲಿ 7 ಬಾರಿ ಲಸಿಕೆ ತಪ್ಪದಿರಲಿ 1 ಬಾರಿ. So you have birth doses given in the hospital itself, that is BCG, OPV 0 dose and hepatitis vaccine. followed by 6 weeks, 10 weeks, 14 weeks, covering pentavalent, fractional IPV, and PCV and rotavirus vaccines, pneumococcal vaccine and rotavirus vaccine. And 9 to 12 months, we'll see the introduction of measles, rubella, and JE doses. 16 to 24 months, time for boosters, and 5 to 6 years, the booster for DPT, that is called DPT B2, booster 2. So this completes the 7 visits. 5 ವರ್ಷದಲ್ಲಿ 7 ಬಾರಿ. So this is the thing. And adolescent vaccination is also there in universal immunization program. That is 10th year, 16th year, and pregnant women. Pregnant women are also the beneficiaries, as we know. So pregnant women are given TD vaccination. And for adolescents also, we are using 10th year, 16th year, that is school vaccination program, TD vaccines, that is TD1 and TD2. So this is the updated national immunization schedule, which is in implementation from 1st January 2023. So all of us now we know about this, the largest public health program or largest vaccination program in the world. And the manufacturing capacity of the country is reiterated in one word, that is entire globe. Out of 3 children, 1 child will receive a made in India vaccine. So that is the scope and scale of the immunization program and vaccine manufacturing capabilities of the country. We are all proud to be part of this program. And what are these aims and objectives? For any program, there needs to be some aims and objectives of the program. And for universal immunization program, the goal is only one. All the eligible beneficiaries should be getting all these vaccines in the national immunization schedule. I have highlighted 2 things. The next priority for the country is achieving the measles rubella elimination. So that is 2026 December, the country is slated to eliminate measles and rubella. That is the priority now. And to sustain robust vaccine preventable disease and AEFI surveillance. Now these 2 things got integrated into universal immunization program, because we'll be delving little bit deep into these 2 in the coming slides. Next and all, I think this supportive mechanisms through the accountability as well as immunization coverages, they will all be there. But the priority is MR elimination and to sustain the robust VPD and AEFI surveillance. Not to forget to sustain the polio-free status and maternal and neonatal elimination status, tetanus elimination status. So as we mentioned, VPD and AEFI surveillance, we'll be getting into the surveillance part now. What is surveillance? So this is a textbook definition of surveillance: continuous scrutiny of factors determining the occurrence and distribution of disease and other conditions of ill health. So that is the textbook definition that we all read in PARC. But for us in public health, surveillance includes data collection from the reporting units or reporting sites, analysis of this data, interpretation, and distributing the relevant information for action. Simply stated, surveillance in public health is data collection for action. So there comes the importance of medical college and OPD here. And the objectives of surveillance, as you can see, there are so many objectives are there generally, and it's already told in the inaugural session also. But I have highlighted only one part, that is evaluating this universal immunization program and defining the need for supplementary immunization activities. So today, I think we have got all the micro plans from the district. Tomorrow is very significant day in immunization. It is celebrated as World Immunization Week, Vishwa Lasika Saptaha. So to commemorate this, special immunization drives have been planned across the state. All the 32 districts will be doing these special immunization drives in high priority, high focus areas. And this 1 week of April will be carried forward for May and June. 3 rounds of special immunization drives will be conducted. Tomorrow is a very significant day in the special immunization drives for the state of Karnataka. So how to determine this, which should be the area, which should be the priority areas to be taken up, surveillance plays a very important role. And though we say 12 diseases are being prevented in the universal immunization program in the country today, there are only 6 focused vaccine preventable diseases that are under the lab supported surveillance. And tetanus, as you know, there is no lab support for tetanus. It is just the clinical diagnosis, and all those 5 diseases are having a lab supported surveillance system, which is a very well entrenched system, which is there in the working in the district. and let us know about our responsibilities one by one. So why vaccine preventable disease? There are two, three things are there, which is already told. One is the victory over polio. Country's victory over polio needs to be continued, and globally polio has not been eradicated yet. So that is why we need AFP surveillance. And measles rubella elimination is slated for 2026 December. Hence, fever surveillance is there. And DPT, I think since 1985, if you can agree, so there used to be a board in front of all the doctors, that is DPT or triple antigen is being given for the children. So such a old vaccine. So if you find suspect cases of diphtheria persists even now, then it shows where are the pockets where the immunization needs to be strengthened. And monitoring the status of this neonatal tetanus elimination becomes a very important objective of VPD surveillance. So, are there any changes in the immunization program because of surveillance? Whatever inputs you have given to the district, has anything changed? So, let us see. This is the change that immunization strategy has taken up from surveillance. So in AFP, from AFP surveillance, we could decide how many number of pulse polio rounds needed to be during polio days, how many number of subnational immunization days, national immunization days, or mop-up activities where it should be conducted is decided by surveillance data. And type of vaccine, it is not just the oral polio vaccine which we use since long.